afternoon, everybody. It is a beautiful day to get vaccinated, and that's what's happening here at the Swift factory at Five Corners in the Northeast neighborhood. And I just want to start by saying, first of all, a big thank you to the governor and his team for the incredible job that they're doing and the incredible partnership that they have shown all the way through this process. We wouldn't be able to hold these no appointment walk-up clinics around our community without the active partnership of the governor and his team. In particular, as I always do, want to give a shout out to Josh Jabal and Michelle Gilman and the whole team there that has coordinated the vaccination effort. Governor, they've been tremendous and we're really grateful. A big part of our effort to get our community vaccinated is to remove every barrier, to make it as easy as possible. And one of the biggest ways we're doing that is by holding these walk-up clinics where you don't need an appointment, where you can come right up if you're a Hartford resident and get yourself protected from the virus. Here today, we're doing about 250 vaccines. These are all Johnson & Johnson, so once you get it, you're done, one and done. Again, as easy and quick as possible. The other thing that I wanted to announce today is something that we've actually been doing for a couple of weeks, and that is an effort to vaccinate those in our community who are homebound, who aren't able to leave home. And to do that, our health department has partnered with Harriet Home Care, and Sasa Harriet, who is the founder and president of Harriet Home Care, is with us today. She and her team have been doing a phenomenal job. They've been at it for about 3 weeks already. I know we've done we're doing about 80 of those homebound vaccinations this week, but our goal is to do 100 of those vaccinations each week for residents who can't leave their home. We think that's such an important part of this effort to get our community vaccinated. Oftentimes, those who are stuck at home are among the most vulnerable to the virus. Even if they're not leaving, their loved ones may be, their caretaker may be, they're interacting with others, and their health conditions or age may be such that they're particularly vulnerable. So we wanted to make sure that even as we're holding walk-up clinics like this, where anyone can drive up, walk up, come up and get vaccinated, we're also bringing these vaccines to the homes of those who can't get here. We want to make sure that we're meeting people where they are. That means here at Five Corners, but it also means right at their home if that's what they need. The walk-up clinics are now the priority of our health department team. And as you all know, the head of our health department is Liani Arroyo. She and her team have been absolutely tireless in the work that they're doing. And I cannot thank them enough for everything they've done. So I'd like now to turn this over to Liani Arroyo, our Director of Health and Human Services, to say a few words. Liani, thank you so much. You and your team have been phenomenal.
Good afternoon, everyone. Thank you, Mayor. Thank you, Governor, for being here. Our team here at the Hartford Health Department is small but mighty, and we've been very lucky to have great support from the state and as well as great support from the philanthropic community to be able to have the staff and the volunteers, including the Medical Reserve Corps for the Capital Region, here supporting us in these efforts. These walk-up clinics are something that we've been wanting to do. And we're very happy that it's now open to everyone because it makes it a lot easier to be out in the community. So thank you, Governor, for your foresight and the rollout and getting us to this point much more quickly than we were hoping to be there. So we're here now, and we're inviting the community to come out. No barriers. What we've heard from people in line is they've been trying to make appointments. It's challenging at times to wait. They can't get appointments quickly enough or as quickly as they would like, and this is just an opportunity for individuals to come out basically in their own home, in their own neighborhood, and get vaccinated. If you're undocumented, we will vaccinate you as well. Just bring mail that has a City of Hartford address that's less than 90 days old. These clinics are open to everyone that is a Hartford resident. Tomorrow and Thursday we'll be out in the community as well. You can check our social media for those locations. But this truly is a testament to the work and the leadership of my clinic director, Monique Dunstan-Campbell, who's wanted to get this done and be out in the community and in places where people congregate. Say some Spanish, are you okay? Le quiero hablar a la comunidad hispana también hoy día. Estamos aquí en la comunidad dando vacunas gratis a la comunidad, no importa si no tienes documentos, después que seas residente de la ciudad de Hartford. Y para presentar su residencia de la ciudad de Hartford, solamente necesitamos cualquier correo postal que le llegue a su casa con su nombre y dirección en la ciudad de Hartford. No importa si no tiene identificación del estado de Connecticut o del gobierno federal, pero si tiene una identificación de su país de origen, está bien después que tenga cualquier postal dirigido a su nombre, a su casa. Así que le estamos invitando mañana también. Si le pones a las redes sociales, el ojo a las redes sociales, vas a ver dónde vamos a estar mañana y el jueves para seguir haciendo las vacunaciones en nuestra comunidad. Gracias.
Great, thank you so much, Liani, and again, thanks to your entire team. And now, Sasa, Harriet, thanks again for the work you're doing to bring this vaccine into the homes of those who can't come to clinics like this. It's such a huge part of the effort. Really grateful.
Good afternoon, everyone. Once again, I'm Sasa Harriet, and I'm the owner and CEO of Harriet Home Health Services. At Harriet Home Health Services, we are committed to reducing disparities and ensuring that we secure the lives of our most vulnerable residents. We have many residents of the city of Hartford who have injuries or conditions that prevent them from leaving their homes. Providing vaccines at home is one way to save lives. It helps us to ensure our mission to improve the outcomes for all. Thank you. Thank you to the city of Hartford, Liani and her team. Wonderful job. We appreciate it. Thank you.
Thank you, Sasa. And now, as I said before, this is a daily partnership with the state. And Governor, there's a reason that Connecticut has been a leader around the nation in getting these vaccines rolled out. It's because your team has been as tireless as our team has and focused on a rapid rollout that protects as many people as possible. And as we've all tried to be creative, recognizing the disparities that exist, the significant disparities that exist, we've all tried to be creative and aggressive. And one of the ways was with this kind of walk-up, no appointment necessary clinic, and your team responded quickly to work with us to make that possible. So it's great to have you here to see what that means to so many of our residents. Thanks so much, Governor.
All right, well, thank you, Luke and Liani and everybody. I'll tell you why Connecticut's a leader. It's a leader because of amazing leadership like you're providing right here. And it takes a lot of imagination. We're bringing the vaccine to you, trying to make it easier, and that wasn't always good enough. So here it is right now, right here. It's been easy, hasn't it? It's okay getting vaccinated. It's not bad. People are just walking in. They're saying, hey, can I get vaccinated? Yes, you can. Come to the Swift factory right now. It's 4:20. We have another, hour and a half. Yep. Come on by. It's very liberating. You're going to feel good. It's good for you. It's good for your family. And when you had your vaccine, go tell a friend and have them tell a friend. It's like old-fashioned game of telephone. And that's how we make a difference. That's how we break the back of COVID and get back to a really amazing summer here in Hartford and across the state. Look forward to seeing you here.
Thanks so much, Governor. One last thing before we take any questions you've got. Our walk-up clinic tomorrow is scheduled for the Free Center, which is at 460 New Britain Avenue. We're going to be holding these clinics nearly every day. We're trying to do this as much as possible, but again, tomorrow it's at the Free Center, 460 New Britain Avenue. Plan to be down there if you haven't gotten one yet. And happy to take questions.
For either you or for Liani, you said that the walk-up clinic is sort of the new priority in terms of vaccinating Hartford residents. Why is that? Why is that now the priority?
Sure. So the question is, why are we and our health department prioritizing these walk-up clinics? It's important to remember that the vaccination effort is a partnership with many, many different partners. Here in the city of Hartford, we're lucky to have two great hospital systems, Hartford Healthcare and Trinity Health in New England and St. Francis. Between them, they've got about 5 sites that are running every single day in the city of Hartford where you schedule with appointments. We've got our FQHCs, federally qualified health centers, doing mobile clinics. We've got vaccinations at multiple pharmacies. And we also have more and more pop-up clinics that we're doing in partnership with our hospitals. Our health department is just one of the players in this vaccination effort. And because of scale, we don't have a health department the size of a hospital. Because of scale, we want to prioritize the vaccines that we get to make sure that we are delivering them in a way that has the fewest barriers possible. And what we've discovered is that the easiest way to do that is to do it with literally no barriers, to simply open a clinic and say, if you are eligible to get the vaccine today. We tried it last week down at the Walmart on Flatbush Avenue. We had tremendous success, and we decided that this is the best way that we can use our allocation of vaccines to get as many Hartford residents as possible vaccinated as quickly as possible.
J&J your vaccine of choice?
The question was, is J&J our vaccine of choice? Our health department, just like the hospitals, is administering multiple vaccines. But at these walk-up clinics, we are using J&J because that way, when somebody comes up, walks up, gets vaccinated, they're done. We don't need to follow up with them 3 or 4 weeks later. They're protected. It's one and done. And so it seems like the best fit for these walk-up clinics.
Governor, do you have any updated stats on how you're doing with communities of color?
I don't have that right now, Pat. Governor, can you talk at all about today's COVID numbers? If you have them, what your reflections are?
The question is, how are we doing on the COVID numbers today? I can't give you the exact numbers. I do know we had additional hospitalizations, and the infection rates went up maybe to about 5%. So we've been somewhere in that 3, 4, 5% now, going on about a month. But it's something we're watching carefully. As you heard from the briefing, we're looking at New York City and New Jersey, where they've had a bit of a flare-up over the course of the last month or so, which is why I am so proud of Hartford making sure that everybody gets vaccinated. Tell your friends, it's worth doing.
You've talked about how you don't think that we will experience as much death related to COVID-19 because the most vulnerable, the older people, are vaccinated. So does it concern you at all that to see hospitalizations going up, given that when people are hospitalized, that kind of makes them vulnerable, that indicates that they are having serious disease and could die?
Hospitalizations have trended up a little bit. People who are younger and less sick than they were maybe 6 months ago, we're still getting them into the hospital because we have the capacity to do it, and the fatalities are much less. So right now, I feel like it's a situation we have under control, but it only works if you all get vaccinated.
What's the latest modeling on when transmission rates should start to fall based on how many people would be vaccinated?
We were on with Dr. Fauci this morning and Scott Gottlieb yesterday, and they were both hopeful that you'd start seeing infection rates trending down in about a month. And I'm hopeful that they're right.
I have a question for Director Arroyo. How many people showed up to the Flatbush Clinic, and how many showed up so far today? And if you don't have those numbers, can you just describe to us how much residents are utilizing these clinics?
So at the Flatbush Avenue, when we were there, I think we probably had about 300 folks show up. We vaccinated 260, and other folks that were there we made appointments for. Some folks we turned away because they were not Hartford residents, but we also work with them to try and help them find appointments as well. So far here, I know they're I think at 112 in terms of vaccination, so we're probably about 140 in terms of numbers, give or take.
And then are you guys still scheduling people, if you run out, are you still scheduling them for another clinic down the road?
Absolutely. So we are continuing with our Saturday clinics. We'll be at Dunkin' Donuts Park this weekend doing a second dose Moderna clinic and a first dose J&J clinic.
Liana, you had said at one point that it was difficult to restrict vaccines only to Hartford residents because they're a federal asset. So what has changed? What allows you to do that?
I think there's more vaccine now, so there's more coming in. There's more options for people to be vaccinated. And I think the numbers don't lie. We saw that Hartford has fallen behind. And so we needed to make it easier for our residents and be able to restrict, but also still facilitate access for other individuals. So given the increased allocation that we've been able to receive and the increased allocation that everyone's been receiving thus far because of what's coming into the state, it makes it easier to do that.
Do you have any sense as to if you've made progress on the issue of hesitancy?
So I think there's people that want more information. I don't like call it hesitancy. Those that have worked with me know that. what I call it is there's a need for more information. So we definitely see that, and even in the line, people ask us questions. They want more information, and we answer those. Answer those questions. The biggest thing I think that helps with that hesitancy is people seeing other people get vaccinated. So as we've been standing here, people have stopped, asked what's going on. Oh, I have an appointment in 3 weeks. Can I get vaccinated here? Absolutely. Come on down, cancel your appointment, come get vaccinated here if it's convenient for you. So I think seeing other people, and as we have more and more people in the city of Hartford get vaccinated, more and more people will see that it's fine, that it's safe, and be more willing to get vaccinated.
What are the kinds of questions you're getting?
Which vaccine is better? I've heard questions about myths that exist about the vaccines, and so we answer them honestly, provide them the information that we have, and then help them make that decision. But ultimately, it is their decision to make.
Add, Leonie, correct me if I'm wrong, but I think there's also, a contingent of folks out there who are sort of saying, I'm going to wait and see. And our response to that is, don't wait and see. Get yourself protected, because one of the bigger risks that we all face is this race of vaccines against the variants. And if we all wait and see, or if too many people wait and see, we give the variants that opportunity to come back and to come and beat us. And so if we want to put this pandemic in the past and beat this virus, we got to all do it together. And we need to do it as fast as we can. And if you are not sure you want to get the vaccine for yourself, as we always say, if it's not for you, do it for your loved ones, do it for your coworkers, do it for your community, because we're all in this together. We got to beat this thing together, or we're going to be living with this thing for a lot longer than we want to.
Nothing left to wait and see. We've had 100 million vaccinations going on 8 months. It's been safe and it's effective and it's working. I think we're great. Thanks, everybody.